My question is probably for Cara. I am the mother of a little boy with HLHS. He has a variant form of HLHS, and when I was pregnant, before I even knew I was pregnant, I was exposed to the Coxsackie virus, which many moms know is hand, foot, and mouth. And my doctor ran viral titers when she noticed that his heart was dilated. And so I guess my question for you is related to research in regards to viruses and how they can contribute to congenital heart defects. Are there studies going on right now that would indicate that causing some congenital heart defects?
I'm probably going to have to get back to you on that. Because what we're really focusing now is we have a research agenda, and so we're trying to prioritize the areas that we think are the biggest heavy hitters. And so nothing's coming up, but that doesn't mean we might not have a project. We have over 250 proposals, and as I said, about a quarter of those. I mean, it's really exciting, some of the numbers that we were able to get, and there are so many research questions that we're trying to answer right now. And so maybe if we can touch base afterward, and I can certainly go back and look at some of the areas that we're researching and trying to see if there's something specific for that.
Ask question.
So my question is for Dr. Dadlani. As a support organization, we give a lot of information to our families when they ask on a very broad spectrum. And so as we deal with families who have gotten as much information as their doctors give them, they still have a child that passes away, how do we address some of that 10% of patients passing away when it doesn't seem like they really got those type of statistics to begin with?
Right, I think if you've had a child that passed away, I don't know if your question was related to another pregnancy for that same family. One thing that I think is very important if you do have a child that passes away is go back and regroup with your medical provider afterwards, so that one, you can get closure to that, and two, make sure that you have genetic counseling with future pregnancies. As you look at prenatally diagnosing congenital heart disease, we talked about fetal echocardiograms, typically between 18 to 22 weeks. You can go, push that down at some centers if you want to do a transvaginal ultrasound as well. They can do that as low as 15 weeks. With that, there's also, I had a slide up there on cell-free DNA testing, fetal DNA testing. You can do that around 10 weeks of age in a pregnancy. So the fetus, as it puts out, or as it's growing within the womb, will deposit some DNA into the maternal circulation, and you can test that today to look for common genetic syndromes. So it's not all forms of congenital heart disease, but if your child had a major genetic syndrome, you can pick that up as early as 10 weeks now by just doing a blood test on mom with that. In terms of counseling for congenital heart disease, it really depends on the type of lesion. So if the child passed away, most commonly those are critical forms of congenital heart disease, like hypoplastic left heart or various forms of single ventricle physiology. The recurrence rate for those, you have to look at the specific type. Left-sided heart lesions can run higher, but most other forms of having a single ventricle child fit back into that 5% range or less with that for counseling them.